Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are on retinal diseases, do's and don'ts. Doctor, my first question for you is, what are the common symptoms of retinal diseases and when should I seek medical attention?
See, in retinal diseases, one is a preventive checkup and one is if you are having any problem. So retina preventive checkup is very important, especially in case, especially in India, which is becoming a diabetic capital of the world, is diabetes. If you are a diabetic, so then you need to have a retina checkup, routine retina checkup, even if you are having no symptoms in eye at all. And that has to be first at the time of the diagnosis, whenever age, whatever age you are diagnosed, first at that time you have to get. And after that, if you are absolutely fine, if not once a year, at least once bi-yearly, you have to get your retina checked. If you don't have any problem, that is if you are absolutely symptom free. Otherwise, if you develop any symptoms, like very common symptoms in retinal disease is floaters. Patient complain of I keep seeing some black flying objects. They often complain to like a cobwebs kind of thing in front of the eye. If that ever develops, you have to get your retina checkup done ASAP. Apart from this, any deterioration in vision, any deterioration, especially field of vision, that is sign of a retinal detachment or probably a vitreous hemorrhage or something, then you have to get your retina checkup. And if you have a family issue, again, and high myopia, if you have a high myop, you have a high minus power, then obviously you have a tendency to develop more of retinal diseases, like you may have thin retinas, you have holes in the retina, you have lattice, all those things. So then in that case also you need to get a dilated retina checkup once a year.
What kind of lifestyle changes or habits should I adopt to protect my retinal health and prevent diseases?
Again, the preventive treatment retina, as the most common, as we were discussing, is the diabetic retinopathy. So only remedy for that, you only prevent from that, having a good diabetic control. You should have a good diabetic control, not shy from taking medicine. Like a lot of patients, especially in India, there's a tendency to avoid medications, especially in diabetes. Patients keep saying, because I feel good, I don't have any symptoms, so I should try to take medicines for diabetes. I don't have any, because diabetes just it suddenly strikes. You will have one problem one fine day, and then the remedies are very difficult. So proper diabetic control in case you are a diabetic. If you are talking of myopia, well, there are not much of preventive thing which you can do, but you can be observant. If you have any signs, as we talked about, we have floaters. Your photopsia is having an spark like or a glittering object like sensation in front of the eye, or in sudden decreased vision or difficulties vision, you should always just rush to your retinal doctor and have your retina checked up. Apart from that, good blood pressure changes also tend to have some damage to the retina. So a good the good systemic control is the key, whether it's diabetes, hypertension, and myopia. Also, obviously there's not much you can do because it's not a modifiable factor, but you need to be observant about your things, about your symptoms.
Are there any specific activities or environmental factors that I should avoid to reduce the risk of retinal diseases?
Yes, see, as we already discussed, the most important preventive aspect in retina is your systemic control of sugar and diabetes. We were talking. Environmental factors, I wouldn't contribute much. That there are much of environmental factors that you can do to prevent your retinal diseases. The only thing is, like, probably your workplace modifications. Like, suppose you're working in an industry where there's a chances of a splinter injury or trauma. We are working in an industry or working in a factory where there are some heavy equipments, or there are some chances of a splinter injury. Probably use protective goggles and glasses so that you don't have a injury to the eye and a counterproductive injury to the retina. And you need to retinal disease is much of awareness. You need to be aware that it can be something like a retinal disorder. And in most of the retinal conditions, maximum of them have a genetic preponderance. So if your parents, your siblings had any retinal condition, had been diagnosed ever with that, you should be prepared about that. And yeah, one important thing about retina, which I was forgetting, was it's the ROP, the retinopathy of prematurity. That is a very important thing. Young newborns, especially who are born at a, who have been premature, born prematurely and born at a lower birth weight, less than 2 kg, especially, their retina needs to be checked up thoroughly at the very onset, at their birth or within 1 month of the birth. Because retinopathy of prematurity is a blinding illness which is coming up nowadays much more paradoxically with advancing medical science. That disease is increasing because now we are able to save those babies who have been born prematurely. Earlier, probably 20 years back, those babies used to, we were not able to save that baby, so we were not seeing that disease at all. Since now the babies are being retrieved, they are being saved, so the disease is increasing. So that here the role of the pediatricians and the gynecologists and the obstetricians come, that if they have any baby who is premature, they should guide the parents to get the baby checked with an ophthalmologist.
So doctor, your expertise and insights on retinal diseases, do's and don'ts are invaluable to this initiative, and we believe your participation will greatly benefit the patients.